things that I need to keep an eye on?
So one of the first things that I would address, or sort of the two things actually, would be thinking about heart disease first of all. So that is the thing that women will die of even before breast cancer.
Right.
Okay. And you know, we often just think of men getting heart attacks, but that's number one for women.
Right.
And in terms of that, related to that, you have your cholesterol. So we do the full cholesterol panel. Check your blood pressure, ask about family history, obviously smoking, exercise, all the usual things, but shining a light on that just to remind women, because there's no screening program for that, so to speak, like there is for cervical screening. So that's one thing. We would send you information on that as well, just to explain how to really improve your heart health. The second thing is breast health, and you know, I have first-hand knowledge of this now myself, and this is okay, I'm going to be emotional. So we will recommend that you get screening for breast cancer between the age of 40 and 50. So the National Health Service don't screen you until you're 50, but women still get breast cancer in their 40s. And so I had experience of this myself. And you know, for a couple of years I was tired. I'd never been tired in my life, and I'd seen a number of specialists actually, and nobody examined my breasts. We don't examine women's breasts. We kind of think, you know, heart, lungs, abdomen, feel for lymph nodes, but you know, we've kind of lost the art of the physical examination. So from my perspective now, looking back, like I didn't even know you could go and get a mammogram with action cancer. So that's something I'm, you know, really passionate about now. Sorry, I'm getting a bit emotional. And also, you know, so as I said, for smears, it's on our mind. If you don't have a family history, I didn't have a family history. I didn't have any real risk factors that I knew of. And on that point, once I'd had breast cancer, you know, I realised, oh my goodness, I have these risk factors once I started doing a bit more reading. So one of them is having a previous biopsy of the breast. So I didn't know that increases the risk of breast cancer in that tissue.
Would that even be for a cyst? Or?
Yeah, so like I'd had a cyst on this side before, and I think I'd had it biopsied a couple of times, but as far as I remember, nobody said, you know, that increases your risk.
Didn't know that. I've had a lot of biopsies. So,
yeah.
You know.
And so I guess I'm sharing this just so that, you know, if you've had a biopsy, you don't have a family history, you're super healthy, that you still think breast cancer is something that can affect me. And the other thing about it is screening is there to pick it up early, so it's not that I'm saying, you know, prevention is everything, but early detection is so important, and I realise that, and that's one of the reasons our longevity health check as well is there for early detection of disease. And most doctors historically were male, and so might not have been thinking of breast cancer, I think also. But as I say, the physical examination, we have just lost that art of, you know, doing a breast exam. And I watched this TV program after I'd been diagnosed, and the lady went to see her doctor in Canada, and she was tired, and the first thing the male doctor did was examine her breasts, you know. So what else for risk factors? Yes, if you've had long courses of antibiotics as a teenager or as a young adult, which I had for acne, and we still prescribe antibiotics for acne as well, so yeah, that's another risk factor. There was one other one, yes, having your kids in your 40s, your first child.
Okay.
Didn't know it. So your breast tissue has never been exposed to this really high level of estrogen. So whenever you're pregnant, obviously your body is full of estrogen, and then that can cause malignant changes in the breast tissue. So breast cancer, it's really common. Treatments have advanced, so treatments are really good, but also they are good, but you'd rather pick it up early, you know, than wait till it's in your lymph nodes or whatever. And I appreciate that some cancers, you know, will present very late, and there are other types of cancer, not just breast cancer, where, you know, obviously outlooks cannot be as good. So it's part of life, and so we don't become anxious over it either. It's something that, you know, knowledge is power, and I think it's important that women really, take control of their health when they're having kids older as well. So you want to be healthy for your kids.
And have you made a full recovery?
I have made a full recovery. Yes, I'm emotional, but yes, I'm still in some treatment like most people. So yeah.
And you know what, Siobhan, I think this really, you know, your experience really enhances what you do as a doctor. You know, you've been there, you're so empathetic, you truly have been there, and I feel like Vitalis is just a haven for women who have, you know, maybe been overlooked.
Yeah.
So
yeah, I mean, in hindsight, I wish I had a private GP like myself. And the irony is that, you know, I was so busy with life, and there were so many things going on, you know, and I never once thought, oh my goodness, let me look at this breast, because I only fed on one side, which is kind of a bit unusual, but that was my circumstance. And yeah, I was busy, and I see busy women every day who come in here and say, look, I'm just so busy, can't lose weight, you know, can't really eat well, can't exercise because I'm so busy. And these women often have young kids, and you know, so I see myself in that, and I just say, look, this is such an important time, and you know, we have to like pencil in things for your health like you would a business meeting, for example. Yeah.